Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 12 Homeo-Remedies for testicular diseases. What are testes? What are important parts of a testis and their functions? At the very onset, I want to disclose that one of my viewers wanted me to publish a video on testicular atrophy. Now, it is very difficult for me to make a video on testicular atrophy because it will be very short. So what I did, I take common testicular diseases with the most uncommon disease as atrophy, testicular atrophy also, and I described most common and testicular atrophy so that the person who has requested will get all his important information, while the video will be of standard length. But I didn't describe details all the common diseases, but symptoms I have covered 12 medicines. Naturally, so many diseases have been covered relating to testicular disease, I mean testes. So the first question, what are testes? Testis, you mean testis, this term TES is a plural term. The singular term is TES, testis. What are the important parts of testis, of a testis and their functions? There are two oval glands in the scrotum of male persons porting in between the junction point of two thighs. These glands are called testis singular. Each testis is suspended in the scrotum by a rope-like structure comprised of nerves, blood vessels, lymphatics, vas deferens. It is called spermatic cord. In the picture, this is the spermatic cord. On the right hand side, second picture. Other important structures are seminiferous tubules lying within the testicle. That is, if you can slice this, say vertical incision, then you can see this seminiferous tubules. For want of space, I didn't scope to show all the pictures. If you're interested, you can go to internet and have this thing. Just write down what is seminiferous tubules. They will be you will get everything. Will get everything. Lying within the testicle produce sperm. It is most important. It is doing the most important काम. It produces sperm. Leydig cells lying in the testicle also produces hormone testosterone. Epididymis looks like scoma and lying above behind the testis. It is seen from above. This is scoma-like structure. Epididymis contains and transports sperms. Actually, the sperms are produced by seminiferous tubules, and these are carried by this epididymis to vas deferens for other necessary actions. Vas deferens carries sperm to seminal vesicles. What are the functions of testis? Production of sperm and male hormone testosterone. What is the function of scrotum? Maintenance of temperature of testis through contraction and relaxation. See, the production of hormone, not hormone, but cells, sperms. The production of sperm is a very sensitive process. Particular temperature range must be maintained. Otherwise, sperm will not be synthesized. So that's why the scrotum did this thing. It controls the temperature of the testis so that sperm synthesis goes healthily. What are common diseases of testis? Hydrocele, accumulation of water within the sac of testis. Look at the right second picture. Right side, this is the normal testis sac. This sac is swollen and the space is filled up with water. This is called hydrocele. Hematocele, the same thing when blood is accumulated. Here is blood is accumulated, it will be called hematocele. Varicocele, inflammation of testicular veins. Note these things. This vein, the veins which is part of this spermatic cord that gets swollen. That is called varicocele. Spermatocele, when there is accumulation of sperm within the sac of the gland. Orchitis, now epididymis, inflammation of the epididymis, epididymitis, this is inflammation of epididymis. Orchitis, inflammation of testis or testes. Inguinal hernia, part of colon descends down in the scrotum. Look at this picture. Part of the colon descends down in the scrotum through the hole between abdomen and scrotum. There is a hole. It is an anatomical thing. It is a hole. Generally, it closes or covered, but sometimes it remains open. Then a part of this colon come down in the scrotum. This is called testicular hernia. Testicular torsion, twisting of the spermatic cord. This spermatic cord that get twisted. This is a very emergency nature. It requires immediate attention. Generally, we do not take this patient and straight send the patient to allopathic surgeons. This is very minded. Testicular torsion is a very acute emergency condition. Testicular atrophy, where the testicles become smaller, that is atrophied. Become smaller means atrophied. This is the picture. The normal testis, this is atrophied testicles. Now, as I have already proposed that I will discuss the hydrocele and atrophy in detail. So, what are causes of hydrocele? Hydrocele is resulted from accumulation of water in the sac of testis. Sometimes the communicating hole between abdomen and testis is not closed properly. So, male children gets painless hydrocele. Mind this, male children, maybe baby even. In case of adult male, hydrocele results from injury, infection and imbalance between the water synthesis and absorption. Imbalance between water synthesis, the water synthesis is going within the sac and that the water is also absorbed. If there is disbalance, there is synthesis is more, then accumulation will be there. Otherwise, there may be injury, infection also. What are causes of testicular atrophy? Due to decrease in number of germ cells and Leydig cells in testes, the latter get reduced in size or shrink. You see, plainly, the germ cell numbers are germ cell from which actually sperms generate, and Leydig cell, they go, they decreases in number. Now this is why this decrease. That reason is later on given. Side effects of, this is a true reason, side effects of drugs of allopathic medicines, consuming too much of allopathic drugs. Other reasons being age, that is in high age, old age, hydrocele atrophied automatically. Orchitis, it is a disease. Too much of alcohol. Varicocele is a disease. Imbalance of hormone. Testicular torsion is a disease. Testicular cancer is a disease. So there are so many diseases which can result, which can actually produce rather testicular atrophy. Two of these, orchitis, varicocele, testicular torsion, cancer are there. This picture shows this is the hole is fully closed here. Now the hole is almost closed. This is the hole is remains. The hole between this abdomen and scrotum remains. So water is coming and accumulated. What are the signs symptoms of hydrocele? Owing to accumulation of water in testis, the scrotum gets bigger in size. So there occurs inconvenience in movement, etc. Sometimes pain and tenderness are also felt. What are signs symptoms of testicular atrophy? One or both testes become soft and reduced in size. Other symptoms for persons below puberty, increase in length of penis, absence or reduced beard, mustache and pubic hair. For others, less sex drive, weak muscles, weakness, impotency. Others means this adult actually above this puberty level. Impotency, absence or reduced beard moustache and pubic hair, same as above. Sometimes fever, nausea, inflammation of testes, pain, tenderness are also there. Now, how hydrocele is diagnosed? Say a patient of hydrocele has approached you. You have tested in first clinical examination, that is physical examination by doctor, and you cannot determine confidently that is it has hydrocele. Actually, all doctors do this. All doctors do this. You have to prescribe ultrasonography of testis. That is the confirmatory test of the hydrocele or testicular atrophy. Same thing. It is diagnosis, clinical examination, ultrasonography, and here another test you can do, hormone level test. That is, when the testicular atrophy is there, the production of testosterone will be less. Naturally, hormone level will be less. That is another more test. But final test is USG. Mind that. Now we are taking remedies. The first debating curve. Here in the remedies we have discussed everything, all types of disease almost, atrophy, hydrocele, hematocele, everything. What has come in the picture? 12 medicines. So I have given 12 medicines. Aramate for testicular diseases. Testicular atrophy for pining boys, especially right-sided one gets hard. Mind this. Testicular atrophy is there also. If there is no atrophy but the particular right-sided or left-sided anywhere, maybe hard, that is indurated, then also aura may come. Feeling as if knife is passing through swollen testicle. Generally, atrophy testicle are not swollen. So see, so this medicine can come both in testicular atrophy, also inflammatory types of diseases, as if bruised on touch, itching of scrotum, patient melancholic, always think of committing suicide. The underlying symptom everywhere relates to general symptom, that is the person symptom. You know, in homeopathy, the symptom of a person is a very important thing. You see, there are two types of symptom. One is particular symptom, the symptoms relating to the disease itself. Another is general symptom, the symptom relates to the person. Most important are the person symptom. Mind this, it is homeopathy. Homeopathy treats a person, not a disease. So disease symptoms are less important here. Person symptom is more important. But if you can match both the thing, then medicine will be nicely working, completely curative. Before Ana for testicular disease, testicle atrophied, also atrophy or hypertrophy. Mind this. That is, the before Ana can come in atrophy or hypertrophy. Hypertrophy means increased. Pain as if drawing, twisting in testicle. Sometimes felt as if they tend to get back to abdomen. They tend to get back. They means the glands. You see, these testicles before birth remain in the abdomen. After birth, they come down to the testicle through that window, through that opening from abdomen to scrotal sac. Now here the symptom says that if the patient feels that the testicle tends to go upward, that is as if they are going back to their original place in abdomen. So it is written, they tend to get back to abdomen. This is their original abode. Penis swollen, red, burns. Patient looks solitude to practice masturbation, cannot tolerate music. General symptom of before Ana, patient symptoms. Scrotum cold, impotency. Testicle atrophied. Spermatic cord shriveled. Spasmodic pain after ejaculation. Patients homesick, chilly, shudder when drink water. General symptom. Arsenicum from testicle. Edema of scrotum. Baby scrotum as if raw. Sacs bluish. Hydrocele of scrofulous children. Patient anxious, restless, very weak, fears death. General symptoms. Silicea for testicular disease. Scanty swelling of penis and testis. Wet spot and sweat on scrotum. Hydrocele of scrofulous children. Scrofulous children means tubercular children. Children who has inherited tuberculosis from their family. Patients very chilly, wear woolen dresses in summer, even silicea patient symptom. Carbo animalis for testicular disease. Testis atrophied gradually. Penis fully relaxed. Very weak feeling in scrotum, penis. Patients desire to be alone, avoid talking, weeps during meal and homesick. These are general symptoms. Ginkamate for testicular diseases, scrotum shrinks, orchitis from injury, drawing pains in one or both testes. Affection moves from right to left. Trouble start from suppression of otorrhea. Otorrhea suppressed, testicular atrophy started or testicular problem starts. Patient severe hungry between 11 and 12 noon. General symptoms. Staphysagria for testicular disease, testis atrophied or get inflamed, burning, stinging, pressing, drawing pains, shooting pain along spermatic cord. That is something inflammatory. Voluptuous itching in scrotum. Pain in outer surface of the left testis, worse from touch. Patient almost always absorbed in sexual thought. Ailments from reserved disclosure. General symptoms of staphysagria. Fluoric acid for testicular disease. Varicocele and hydrocele. Note this thing. Varicocele, hydrocele after syphilis. Patients too weak, premature aging. Pains come suddenly and stays sometime, goes suddenly. The last line is general symptoms. Gelsemium for testicular diseases. Pain is cold and relaxed. Drawing pain in testis. Always warm sweat on scrotum. Remedy work nice when disease starts. That is, gelsemium is a medicine for starting phase. Patients dull, drowsy, dizzy. General symptoms: lack to be left alone, apathetic. Complete general symptom. Phatak for testicular diseases, orchitis from gonorrhea or secondary syphilis. Mind this: gonorrhea, secondary syphilis. From this disease, it is orchitis comes. Then Phatak. Right side affected much. Worse from warm fomentation. If you give a warm fomentation, you will get pain more. Pain comes and goes suddenly. Refuse food even after beseeching. This line is general symptom of the Phatak patient. Helleborus for testicular diseases. Hydrocele of both testes after suppression of skin diseases. Hydrocele of both testes. Mind this, both testes seldom affected. But here, after suppression of skin disease, both testes affected. If it is so, then this is an USP, that is uncommon, strange, peculiar symptom. You need not study the case anymore. Directly go to Helleborus and you start with 200. I think the case will be cured with one or few doses, or maybe you require 1 m. Worse during 4 to 8 p.m. Patient's urine dark red albuminous. Hysterical mania from self-accusation. Involuntary sighing, irritable from consolation. These are all Helleborus general symptoms.